are you today?
I've been better.
What brings you in today?
I've had a sore throat and a runny nose for about a week, and I've had some drainage, like some color drainage from my nose as well, and my ears kind of feel like they're all clogged up.
Okay. Any like cough or respiratory symptoms?
Yeah, I do have a cough.
Okay. And have you had any fevers?
No fevers.
Okay. Well, we're gonna go ahead and check you out, and I'm gonna ask you some basic questions before I do an assessment on you.
Okay.
Have you been taking anything for your symptoms?
I tried Mucinex. It helped a tiny bit.
Okay. Do you have any significant medical history or surgical history?
No.
Okay. Are you on any medications regularly?
No.
Okay. And do you have any allergies to medications or latex?
No.
What about seasonal allergies?
No. Yeah.
Okay. Have you ever been hospitalized before?
No.
Would you describe yourself overall as a healthy individual?
Yes.
Okay. And are you up to date on your immunizations?
Yes.
And what about flu and COVID vaccines?
Yes.
Okay. What about your family history? Are your mother and father alive?
Yes.
And do they have any history of diabetes, hypertension, asthma?
Yeah, my mom has asthma. My dad
Okay.
has hypertension.
Okay. And do you have any siblings?
Yes, I have a sister and a brother.
Okay. And are they alive and healthy?
Yes.
And do they have any medical conditions?
No, my brother just has allergies like me.
Okay. Seasonal allergies.
Mm-hmm.
Okay. I note that you're 22 years old. Are you in college? Do you work?
Yes, I'm in college and I work roughly 16 hours a week on campus.
Okay. And do you drink alcohol?
Just on the weekends, like a few drinks on the weekends.
Like 2 drinks, 3 drinks?
2 drinks.
Perfect. And what about nicotine or tobacco? Do you smoke cigarettes, vape,
No.
chew tobacco? Any illicit drug use?
No.
Okay. And do you work out?
Yes.
Mm-hmm. How often?
5 times a week. I run 3 miles, and I also do some weightlifting.
Okay. And do you use caffeine?
I drink probably an energy drink a day, I'd say.
Okay. And how would you identify yourself? Like gender?
Male.
Heterosexual male?
Mm-hmm.
Okay. And how? Have you been feeling fatigued lately?
Yes.
Okay.
Yeah, I have been feeling a little not quite up to par.
Okay, and you told me that you've had no fevers. What about chills, night sweats, loss of appetite, weight fluctuations?
Nope.
Okay. And do you wear contacts or glasses?
Nope.
Okay. Have you had any issues with blurry vision?
No.
Okay. And have you had any discharge from your ears?
No.
Okay. You said they were feeling clogged.
Mm-hmm.
Okay. And you said sore throat.
Mm-hmm.
Okay. What about any chest pain or palpitations or swelling in your hands or feet? Have you noted any of that? Okay. And have you had any difficulty breathing?
No.
Okay. Have you noticed any lumps or rashes on your chest?
No.
And you said you have a cough and that you're coughing up, or do you have a cough?
Yeah.
Okay. And are you coughing up, what colors? Are you coughing up anything?
Yeah. It's like yellowish, greenish.
Okay. Thick, thin?
Moderate, I'd say.
Okay. And how about your bowel habits? Have you noticed constipation, diarrhea, vomiting, blood in your stool?
No.
Okay. And any abdominal pain today?
No.
And have you had any blood in your urine or any issues with urinating? Frequency, urgency? Okay.
No.
And do you know any lesions or rashes on your skin?
Mm-mm.
Okay. And Have you had any intolerance to hot or cold lately, or noticed that you felt like your blood sugar has been high or low?
No.
Okay. Have you noticed any tenderness over your lymph nodes and like your neck or behind your head?
No.
Okay. Any pain in your joints anywhere?
No.
Dizziness?
Mm-mm.
Okay. Numbness or tingling anywhere? Headaches? Sleep disturbances? Depression? Anxiety? Feeling like you're gonna hurt somebody else or yourself?
No.
Okay. I see that the aide already got your vital signs and that you're 132 pounds and you're 5 foot. Your BMI is 21.96, which is good. And your temperature was 97.9, so no fever. Heart rate was 62. Respirations are 12. Blood pressure looks good. Oxygen 94% en room air. And now we're gonna start. I'm going to do an assessment with you. Okay.
All right.
I am going to start by checking your eyes and your eyelids. Go ahead and close your eyes for me. Do you have any tenderness when I touch your eyes?
No.
Okay, and you can open, and your sclera are white. I do not see any redness, no discharge, no foreign bodies in your eyes, no swelling. We will next look at your ears, and your ears are nice and symmetrical. They are appropriate color. Do you have any tenderness when I am palpating your ears? Okay. And have you had any earaches?
No, just clogged, like I said.
Okay. I'm going to look inside of your ears. And your ear canal, I don't see any lesions or foreign bodies. Your ear canal is not red. I see your auditory canal. There's no earwax inside of your ear. Nice and pink inside. Your tympanic membrane is pearly white and shiny. No blood in your ears or any lesions. And I'm going to look inside of your other ear. Okay, auditory canal is nice and pink. I don't see any redness, any lesions, foreign bodies in here. Your ear is nice and clear, no earwax. I see your auditory bones. Your tympanic membrane is also pearly white and shiny in this ear, which is excellent. I'm going to look at your nose. I see you've got some redness outside your nose. Have you been blowing your nose a lot lately?
Mm-hmm.
Yeah. Okay. And does it hurt when I touch your nose?
A little bit.
Okay. And I'm going to look up inside of your nose. And I see some redness in I don't see any septum. Your septum is midline. You do have some green, yellow discharge inside of your nose. And can you go like this for me and breathe out? Good. And is that easy for you? And then go ahead and go back to the other side. Good. Gonna palpate your sinuses, your frontal sinuses. Do you have pain with this?
Yes.
Okay. And down here, do you have pain when I palpate your maxillary sinuses?
Yes.
Okay. And then I'm going to have you open your mouth for me and say, ah. Go ahead and stick your tongue out. Good. And I don't see any white spots in your mouth. Your throat is a little bit red. And your tonsils are grade 1. A little bit of swelling in there. I'm going to feel your lymph nodes. Your pre-auricular lymph nodes. Tell me if you have any pain as I'm feeling. And post-auricular. Any pain?
Mm-hmm.
Okay. Submandibular.
Mm-mm.
Submental.
Mm-mm.
Okay. And pre-cervical lymph nodes.
Mm-mm.
Okay, not feeling any enlargement. Post-cervical.
Nope.
Okay. And your preclavicular lymph nodes
Mm-mm.
and infraclavicular lymph nodes.
Nope.
Okay, and occipital back here. Any pain?
Nope.
Okay. All right. So since your symptoms started a week ago, I'm thinking that you have a just like a common cold, a viral infection called rhinitis. So I am going to have you continue taking Mucinex if that helps. I suggest sleeping with a humidifier. You can take cough drops if you need. I will prescribe you Tessalon pearls to help numb your throat, to help reduce coughing, and I will also prescribe you an inhaler for wheeziness. I need to listen to your chest and your lungs. I'm going to start by listening to your heart. This is your aortic valve, pulmonic valve, and also S2, Erb's point, tricuspid valve, and mitral, and S1 as well. Okay, and I'm going to listen to your lung sounds. Can you take deep breath in and out for me? Good. Okay, and I'm going to listen to your right lung over here. And deep breath in and out. Good, and back here. Another deep breath in and out. Okay, excellent. Your lung sounds are clear. I do note that you have some wheezing. So back to what I was saying, I will prescribe you some Tessalon pearls for cough, and I can prescribe you an albuterol inhaler to take as needed.
Okay.
And drink lots of fluids. Make sure you're getting plenty of rest. And I don't need any follow-up with you unless that you notice you start having ear pain. Then we're concerned about an ear infection. If you notice any like splotches in your mouth or your throat, fever spikes, or your symptoms are still persist after a week, then we can be concerned that your viral infection has turned into a sinus infection.
Okay.
All right. Any questions for me today?
Mm-mm.
All right. Well, thank you.
All right. Thanks.
Mm-hmm.